நாங்கள் என்ன சொல்கிறோன்னா, ஒரு பிரச்சனை இருந்தால் if there is a problem it has to be solved. And ஏஜோட நம்பரை வச்சுட்டு நம்ம இல்லை you are not eligible, you cannot do surgery, you should not do surgery சொல்றது is wrong. But I would request Dr. Ponnaiah, who is the chief neuroanesthetist and head of neurocritical care, to tell us about the factor of age in surgery. 2023-2024 யாருமே வலினால துடிக்க கூடாது. There is no need. Modern medicine 2023-2024 there is a lot of things we can do. So இவரை முதல்ல பார்த்தப்போ once I understood that இனிமே medicines வேலை செய்யாது, medicine சாப்பிடுறது is not good for him because he could fall. The worst thing is in an elderly to fall and break a bone. That is worse. So the first thing that we did is find out whether he has got any problems for anesthesia. So Dr. Ponnaiah and his team saw him, we assessed him, and then we said, yes, we can do the surgery safely. Because surgery, the risk is less than 1%. So we don't want to take also an unnecessary risk. If the risk of doing surgery in him was 30%, then we would have to look at other means. Then we would have told him, illa surgery kadayadu, we have to do other procedures which may not be long lasting, but we don't have a choice. So oru thara and the anesthesia kudukalam, anesthesia can be given. That decision was taken. Then it was only for them to accept to have the surgery. And it is also our job to make them feel confident that yes, it can be done.
இவருக்கு என்னென்ன மாதிரி செக்அப் பண்ணிட்டு அதுக்கப்புறம் நீங்க அந்த ட்ரீட்மெண்ட் ஆரம்பிச்சீங்க?
So MRI was, I showed you the MRI. So MRI for me as a surgeon, I require only an MRI. But as anesthetist, they require
அந்த ஏஜுக்கு ஏற்ற மாதிரியான பிளட் டெஸ்ட், சிம்பிள் இசிஜி, எக்கோகார்டியோகிராம், இது மட்டும் போதுமான மேஜர் பெரிய டெஸ்ட் அந்த மாதிரி அவசியம் இல்லை. மோஸ்ட் இம்பார்ட்டன்ட்லி ஹவுஸ் இஸ் பிசிக்கல் ஆக்டிவிட்டி. பிசிக்கல் ஆக்டிவிட்டி எப்படி இருக்குது, அவரால் ஒரு படி ஏற முடியுமா, இறங்க முடியுமா, அந்த அளவுக்கு ஒரு கெப்பாசிட்டி இருந்தால் then they will be good to go for tolerating the anesthesia.
ஏஜ் வந்து 80, அதுக்கப்புறம் சர்ஜரி டியூரேஷன், அதுக்கு என்ன வால்யூமான அனஸ்தீசியா கொடுக்கணும்னு என்ன கால்குலேஷன்?
அந்த மாதிரி ஒரு கால்குலேஷன் இல்லை. இப்போ ஏஜ் எந்த ஏஜாக இருந்தாலுமே வந்து பர்டிகுலர் டியூரேஷனுக்கு அமௌண்ட் ஆஃப் அனஸ்தீசியா வாட் வி கிவ் ஓகே இஸ் கோயிங் டு பி த சேம். அந்த டோஸு, அந்த மற்ற கேர் அதெல்லாம் மாடிஃபை ஆகும். ஃபார் எக்ஸாம்பிள், ஒரு யங் பேஷண்ட்க்கு கொடுக்குற அனஸ்தீசியாவுக்கும் ஒரு ஏஜான பேஷண்ட் கொடுக்குற அனஸ்தீசியாவுக்கும் there will be some physiological disturbance. அது என்னன்னு நம்ம ஆன்டிசிபேட் பண்ணி அதை ஹேண்டில் பண்ணிட்டோம்னா then that's going to be smooth.
How common is this among older patients, and what are other comorbidities or underlying conditions that would have made this surgery?
This condition is actually very common. There is no actual statistics of this in India especially, but it is very common because I see a lot of patients, because I've been doing the surgery, so I get a lot of referrals. Most often people are not aware that there is treatment for this other than medicines. So it is a very common problem. Very often people go to dentists. I mean, he was lucky to have a dentist who understood that this was trigeminal neuralgia. We get patients, வாய்க்குள்ள எல்லா டீத்தும் எடுத்துட்டு ஒரு பக்கம் ஃபுல்லாவே டீத் எடுத்துருவாங்க, and they would come after that. Then a dentist would say, okay, this is trigeminal neuralgia, this is not a dental problem. So we have many situations like that, but it is common. Second point is, hypertension is supposed to increase the incidence of pain. Supposed to. One of the in medical this thing you would say hypertension is one of the things which increases trigeminal neuralgia. But when you get pain, automatically as a reflex your BP will also go up. So it works both ways. So a patient with trigeminal neuralgia may have high blood pressure. He may be on medications. But then when you do the surgery and the pain goes away, you might find that the person does not require any more medicines. And the hypertension was essentially because of the pain which the patient was suffering. So hypertension is one thing which contributes to this. Otherwise, there is nothing else. It is a normal nerve, normal blood vessel. It is normal anatomy. So it's not that it is only in older age group. I have patients who have in their 20s, 30s also. But we prefer in 20s and 30s to check whether medicines will help them. But I always tell them you have to take this lifelong. So you need to counsel these people saying that it is like, say, diabetes or hypertension, where you have to keep it under control by medication. If you don't take medication, it will again come. So it's seen in all age groups. Is it seen more in elderly? Some people say that yes, because in the elderly, because of changes in the blood vessel, the effect on the nerve is more and therefore it is more prevalent in elderly. There is some literature on that. But there are patients, it's not that it's seen only in the older age group, it is seen in all age groups.